What's up, you guys? My name is Miguel, fellow Xray Tech here, giving you your daily dose of radiation. In today's video, we are covering the different kinds of lead material to keep you safe out in the world of radiology. So to give you context, I'm a night shift Xray Tech. Been doing it for about 4 years, work ungodly amount of overtime by choice, and have pretty good knowledge of what's out there. So depending on where you are, there's different kinds of lead. You have the standard, lead apron that goes like the full body suit that you see like on the stereotypical, like with the thyroid. There's that. Usually that's pretty standard upon all the field of radiology, CAT scan, X-ray, IR, interventional. You'll see it everywhere. That is the standard. Now, some people have what I call the little two-piece, where there's the apron and then there's the top part, which I mainly see those in, if you go to surgery, you see a lot of the techs wear that one. Some of the surgeons wear those to keep them safe. And then I've seen mainly in IR or in surgery, some of the techs wear there's special glasses that keep your eyeballs safe. Those are lead lined too. They look like normal glasses, like just standard little clear little glasses. Different brands. Those, to keep your eyes safe. You have the typical like gonad one. I mean, obviously, if you work in the field, like in the main department of radiology, the whole department should be lead lined, especially where stuff is being exposed. I mean, you have the standard lead, like the walls, and then you have the little clear glass ones that are also to protect you. What other ones do we have? Sometimes if it's more for like the testing, they have like special little pieces of lead that they use, but that's more for like for testing purposes, like when they do the QCs and stuff. If you work in nuke med, they have different kind of leads over there, but that's more to keep the isotopes safe. There's like a giant, like it's almost like a giant 4x4 of just like thick lead. It's like a giant like blocks they have, which keeps the isotopes, which is the radiation they use over there, which kind of like counters that like spews out when they inject the patients. That's a little bit different. But besides that should probably be all of the lead you see out there. Obviously, if you want to buy your own, you probably could. Most places, they offer them. They do yearly checks on them by the state. Well, you're supposed to, after so many times. They run them under like the floor tower to see how cracked they are or how good they are. Usually you'll have like your supervisor and stuff. Now, depending on the lead thickness, they do weigh different. I have noticed this. Some of like the old school ones we have at work, they feel like heavier, and then more of the newer ones, because the board, well, the ART has said that there's been a change in how much lead is actually necessary to keep yourself. Like, there's been some controversy stuff going on about the lead and how some people shouldn't wear it because it actually increases radiation dose. It's kind of a gray area. They're still trying to take care of that. But I think that's mainly that's all the lead that usually gets worn out. Obviously, with time, you see a lot of the veteran techs quit wearing lead, quit caring about that, which I don't think you should ever do, because all the radiation over time, it's not like you absorb it and you can take it forever, and there's X amount you probably get per day, especially if you plan to do this for a very long time. It all adds up. So So I would try to always be safe. You always see veteran techs at some point. I've noticed they quit caring, or they'll quit walking away from the machine as far, and it gets kind of to each their own. I would just, always keep safe, because your thyroid and all your other stuff, it can mess you up. So try to keep safe out there. If you're still here, I appreciate it. I post almost every single day different aspects of this beautiful field of radiology. And yeah, we'll see you on the next one.